Hello everyone, I am Dr. Bilal. I am a consultant neurologist in Hyderabad. In the morning time I practice at Kamineni Hospital, King Koti. So is headache an indication of brain tumor? Can it indicate brain tumor? So quite a few patients seem to have this anxiety that when they experience a severe headache, they tend to search on the internet or even elsewhere. Probably they talk to a friend or somebody who may, depending on the situation, tell them that it is something serious, or it can be somebody with a similar headache had a brain tumor. So with that short introduction, the simple answer to the question is that it can indicate a brain tumor. A headache can be an indication of a brain tumor, but that is just the short answer to it. But there is a lot of detail about it. It is not necessarily true that headache should be directly equated to something very serious as a brain tumor. When somebody is having a headache, they should look into certain factors which can indicate a dangerous type of headache. They are called as red flag symptoms of headache. So we can call them as red flags is something dangerous, red flag symptoms of headache. Quite a few I would like to enumerate. One is if there is a new onset headache. Generally, if you have been having a same type of headache for throughout your life, and now also you are having the same type of headache, then it is generally not a problem, unless if it is interfering with your day-to-day life and if it is very severe. And but general guideline is, if the headache has been there for a long time, if you have been having headache, for example, suppose somebody is having a history of sinusitis and they are having a regular headaches, then if they are having the same type of headache around the nose and in the area around the eyes, and then associated with some nasal block and fever, so it can indicate, then it is an indication that it is okay. It is not a extremely emergency situation or a dangerous situation probably. Apart from that, if headache is, so you should, the person, if somebody is having a new onset headache, then it can be dangerous. Number 2 point is, if somebody is having a headache after 50 years of age, at 50 years of age or after 50 years of age, if it has started at that time a new type of headache, then also it is very particularly important to consult a proper neurologist. That is point number 2. The other thing is, if somebody is having a most severe headache of their life or a very severe headache, this can indicate bleeding inside the brain, which can be in the form of subarachnoid hemorrhage or intracerebral hemorrhage. So these are actually medical terms to describe bleeding inside the brain, different types of bleeding. So this is important. New most severe headache of a lifetime. Something called as thunderclap headache is classically indicated to be a dangerous type of headache, where a person suddenly, like a thunderclap, has a very severe and maximum at onset, and that type of headache. So that should be, you should be careful about that. The headache associated with systemic symptoms, like if somebody is having a headache with severe vomiting, headache with drowsiness, headache with other signs of symptoms of some serious infections, like headache with neck tightness, headache with seizures. So any systemic or neurological symptoms associated with headache, for example, headache associated with any focal weakness, that is any weakness in the arms, legs, face, speech. So these things, if they are there, then they can indicate a serious form of headache, and you should immediately visit the neurologist. Immediately, because important time may be lost for treating the patient. Sometimes the headaches which are, sometimes it can indicate a stroke, or it can indicate a stroke which needs to be treated within the first 4.5 hours, for example. It can indicate some rapidly rising pressure inside the brain due to bleeding in the brain, which can require an immediate surgery. So particularly in patients who are drowsy, vomitings, double vision, blurring of vision. Okay, so all these things, any headache associated with any systemic symptoms which you didn't have previously, particularly. So that type you should visit the neurologist. Yeah, any headache which is associated with any particular positions, with cough, with exercise, if it is increasing, then it can indicate a severe form, something like a third ventricular cyst. There is a meningocele, something like, these are all medical terms to describe some dangerous conditions which can be dangerous. So apart from that, when you can take a headache more less seriously, or you can probably take a paracetamol and defer the visit to the doctor. That situation, of course, it's not a very hard and fast rule that this is a very so and so is a very simple type of headache, and very benign type of headache, and so is a very dangerous type. There is no exact demarcation. Sometimes it can overlap, but generally, if we see, if a headache has been there for a long time, suppose somebody is having migraines for a long time, sinus headache for a long time, tension type headache for a long time, cluster headache for a long time, if this is already your diagnosis and you are having same type of headache, then probably it is nothing serious. It is the same thing coming back. But as I said, any new onset and other things that has to be looked into. So this is a general guideline to differentiate between more of a benign or a simple sort of a less harmful or harmless type of a headache from a more dangerous and serious and critical type of a headache. So with that, suggest that if anybody is having a headache which is interfering with their day-to-day life, particularly one of the most common types of headache is migraine headache, which a lot of female patients, those who have thyroid problems, those who have PCOS, PCOD, polycystic ovary, that is, these people seem to have commonly migraine headache, and then that is a very much curable or treatable condition. You don't need to suffer from the severe headaches and vomitings. If you have any of these dangerous symptoms of headache, I recommend you to visit your nearest neurologist immediately. I practice in the mornings, 9 to 5 hours. I practice here at Kamineni Hospital, King Koti.